Okay, so anticipatory guidance about what parents need to be looking toward for the health of their adolescents. Immunizations that are due in adolescence, the HPV vaccine is usually offered the first dose at age 11. Hep B may be offered if they haven't completed the series, and the meningococcal meningococcal vaccine is offered. Nutrition. Kids are growing rapidly around the years of puberty, and so that leads to increased calorie and nutrient needs and increased appetite. If you've had a teenager in your house, there's like 6 meals. Like currently my 14-year-old has breakfast before school, usually breakfast at school, lunch at school, snack after school, dinner when the family has dinner, and then second dinner before bed, and might get up in the night and eat also. And that's very normal. Okay. Athletes have a further increased need for calories and nutrients. The thing is that teenagers frequently eat high calorie, high sugar foods, but without a lot of nutrients. And they're eating on the run. They have a greater exposure to junk food and fast food. So they may be getting inadequate nutrients. Usually they're getting adequate calories unless they just don't have the food available, but they may be getting inadequate nutrients. And kids who are not active may actually develop excess weight because of the high calorie, high sugar, nutrient poor foods. The maximum lifetime bone mass is usually acquired during adolescence, and most adolescents have a diet that's deficient in calcium. So we want to encourage them to be eating adequate or taking in adequate calcium in some way. But also drinking carbonated sodas can cause calcium loss. Iron deficiency is common, especially for girls. Fad diets are very common. Vegetarian diets are common, and not always for health reasons. Some kids are choosing a vegetarian diet or a vegan diet for philosophical or moral reasons, and they may not actually be eating healthy foods. They're selecting foods purely for what is or isn't in them, or what isn't in them is the real truth. So a vegan diet can be French fries, because if French fries are produced with no animal products, that's vegan. And so we need to make sure, if they're following those diets for moral or philosophical reasons, that we're helping them either get enough nutrients from their foods or from supplements. Kids are also taking supplements for various reasons. One of the most common is going to be athletes taking supplements to try to increase muscle mass, and we need to help them make safe choices in regard to that as well. Cardiovascular health. Some children with obesity actually are now having comorbidities that are usually seen in adults, and that has to do with the change in the foods that are available in our culture now. So we're starting some of those screenings, like lipid screening, earlier. Diabetes screening may be done earlier. Sleep, rest. Kids have varying needs for sleep and rest, but during increased growth, they need more sleep. Adolescents are not, on the whole, getting enough sleep. They're busy, they have school, they have sports, they have social life, they have jobs, they have electronics. They're not getting adequate sleep, or they're not getting good quality sleep when they're asleep. We want to encourage them to put the electronics down and go to sleep, for example. And a lot of kids sleep with their phones. There's kind of this social expectation that they respond to everything, no matter what time of night it is. They're always on, and that interferes with sleep. It also tends to increase stress. Another thing about adolescence is the circadian rhythm shifts later. So it is natural. It is actually a natural phenomenon for them to have a hard time sleeping earlier in the night. So their natural go to sleep time is pushed later, but also have a hard time waking in the morning. Their natural wake up time is later. Schools that have shifted from 8 to 3 to a 9 to 4 schedule actually have shown improvement in test scores and attendance. Exercise and activity. Sports become more serious in high school, which means that kids who are not athletically inclined may not have outlets for physical activity. by high school, we've got, and this may start in middle school, but a lot of middle schools still encourage all kids to participate. But by high school, you've got the people who are really serious about that sport, but there's not a lot for the kids who are not athletes to do physically. So they may become less active. We want to find ways to encourage physical activity for all kids. Dental health, adolescents still need every 6-month cleaning and exams, and a lot of times they may be in the time period of getting orthodontia. Personal hygiene, they may need to bathe more frequently and wash their hair more frequently because of increased sweat and sebum production. Most kids are hyper aware of that. They may be showering 2 or 3 times a day. Early adolescents may need some encouragement to bathe and wear deodorant regularly. An adolescent that's neglecting their hygiene may be having some depression or anxiety. Vision, they need regular screening, and this is usually when refractive errors like being nearsighted peak and those changes stop. So they'll need new glasses every year until they get to adolescent, then they'll stop for a little while. Hearing, the biggest danger to hearing is noise exposure. We want to talk to kids about music volume. I listen to my music too loud. You probably listen to your music too loud. Your kids will probably listen to their music too loud, but we want to try to encourage them to be careful of music volume to avoid hearing loss. Awkward posture is common with rapid growth. Sometimes kids are afraid or they're embarrassed about their body changes. So awkward posture is very common, but we need to make sure we're assessing, is this awkward posture or does this child have scoliosis? So scoliosis also tends to show up during these years because of the rapid growth. Body modifications are more popular now. They may be an expression of personal identity. They may be done for style or aesthetics, or they may be used to mark significant events. Some of the risk of those, allergy is a risk. People can be allergic to the jewelry used for piercing, or they can be allergic to the ink used for tattoos. The other is infection risk and the risk of scarring. Locations that have a lot of exposure to germs are greater risk for infection, and locations that have less circulation like cartilage and have a higher risk of infection. There's also a risk of scarring, and kids need to be aware of that. Body modifications, if they are permanent, kids really are not always thinking about where they're going to be in 5 or 10 years, much less 20. And so parents may want to make some judgment about what modifications that child is allowed to do based on knowing whether they want to live with that permanently. We, as a nurse, your recommendation is that they use a qualified artist to open sterile materials in front of them. So home tattoo kits are a risk. They're a risk to the person getting the tattoo if they're not properly sterilized using new equipment. They're also a high risk for the artist. So amateur tattoo artists are at great risk for exposure to blood and body fluids. So we want to make sure we're encouraging them to use someone who is a professional artist who actually uses appropriate PPE and uses sterile materials opened in front of them. Stress and anxiety in adolescence, there's a lot of stress and anxiety just around the physical and psychosocial changes, but kids put pressure on themselves and they get pressure from parents, teachers, peers, and it has to do with how they're doing in school, how they're doing in sports, how they're doing in other activities. Plus there's a lot of social anxiety, and all of that is besides the environmental stresses that child may be experiencing. Sex education should begin way before adolescence. Middle school is even too late. They really need to start learning about healthy relationships, boundaries, and body differences earlier in life. They need clear, honest information. My children have frequently corrected misinformation that their peers had, and I'm talking about since the year 2000. There are kids right now who believe you can't get pregnant the first time you have sex. You can get STDs from a toilet seat. There's still misinformation out there. And part of that is because adults are afraid if we give information to kids, we're giving them ideas. The reality is the more accurate information kids have, the longer they tend to delay sexual activity. They need information about the risk of sex and how to reduce those risks. And again, giving that information is not giving permission. It's not giving ideas. It's giving them information to make decisions. Kids may see nurses as a source of accurate, confidential information, and that's what we should be. We should be willing to give information that is accurate and to keep that information confidential for the child, so that we are a safe place to come to. There's a lot of inaccurate information in media, social media, and especially in porn. And if kids are not getting education from adults who know about sexuality, they are getting education from porn. And it's very inaccurate. Sexting is common. It's something I didn't have to deal with as a child. Kids need to know that they're whatever they put out into the world can't always be gotten back. That if they send a picture of themselves to another person, that person has the ability to share it with others and may do so. And also they need to know about the legal risk. There are situations in which an adolescent who's underage can actually be arrested for distributing child porn for sending their own picture to someone in confidence. So they need to be aware of the risk. We also need to talk with adolescents about consent. What does it mean to, what does consent mean in terms of sexual activity? Those are conversations that can also be started when kids are much younger. If someone doesn't want to hug, they have the right to say, "Don't hug me." That translates to if someone doesn't want to be kissed, or if someone doesn't want to be touched in a sexual way. So consent conversations really should begin earlier with a discussion about body boundaries. And then that translates naturally into, in adolescence, knowing or understanding that people have the right to make decisions about sexual actions. And we can help kids learn how to resist pressure. Kids may choose to have sex for their own reasons, but frequently they choose to have sex or to participate in some sexual activity because they feel pressured to do so. So again, helping them learn consent, healthy relationships, boundaries can help them resist that pressure to do something that they may not be ready for. Okay, we're going to talk about safety in the last section.